We got Sal here. We're going to do a shoulder treatment. And first thing I want to do is look at his range of motion. So a couple things with Sal I noticed is as he's seated, his head is shifted over towards this side, but it actually makes his shoulder drop on this side. Now I'm going to check range of motion. So I'm going to have you go ahead and abduct your arms, so come all the way up, all the way down. Let's do that a couple times and then stop at the very end. Good. And one more. All the way up. Good. So we're going to hold at the top on this one. And basically what I'm looking at is distance between the bicep and the ear. So on this side, we definitely have a little more restriction in movement. So I'm gonna start to treat this side. So let's have him, we're gonna lay on your back here. Go face up. So there's 3 different muscles we're gonna treat when we treat the shoulder. There's Subscapularis, which is the deepest of the rotator cuff. This one's a fun one, because it's all the way up in the armpit. So not the most comfortable area to have worked on, but it's super effective in getting that range of motion restored. So basically what we have to do is contact the tissue. I'm just gonna kind of watch his face here to see, make sure I'm not killing him too much here. So essentially what we want to do is find the tissue that's not compressing. So I'm compressing down. Once I find a restriction, I'm going to start with some internal and external movements. So because this is a rotator cuff muscle, it's primarily going to be responsible for rotating the arm, but also stabilizing the arm during certain movements. All right, now on this one, you're going to help me a little bit. We're going to reach through your fingertips all the way back. Ooh, yeah. And come back down. He's handling this pretty good, man. He's very stoic right now. That's good. One more. Let's do 2 more. Good. Last one. I'm going to contact a little deeper here. Go ahead and reach through the fingertips. Good. Keep going. 4, 3, 2, 1. And then back down. Ooh, got a little pop on that one. Then I'm just going to do some traction. And then from there, we're going to do some muscle resetting. So I'm going to have him go ahead and contract his muscle against me. So push your wrist up into my fingers here. We're going to hold that for 5 seconds. 4, 3, 2, 1, and release. I'm just going to traction out, go a little bit deeper. So this muscle technique is called Pnf Stretching, where we're basically trying to reset the length of the muscle. 4, 3, 2, 1, release. Good. So basically we're getting him to contract the muscle without it moving, and then once he releases, we have a short window where we can open that muscle up a little bit longer. One more time, push. 4, 3, 2, 1, and release. Nice and easy. Good. We'll check external rotation. He's pretty good there. So I want there to be about 180-degree arc, pretty smooth moving between internal and external rotation. Good. All right. Now from there, I'm going to turn him on to this side here. Raise this up for your head. I'm just going to stack your hips here. Good. Stack them through here. Come a little bit underneath. Now from this position, I'm going to work the back part of the rotator cuff, or the infraspinatus or teres minor muscles. These ones are a little tight on them here. So all these muscles can be contributing restriction in movement. So we want to make sure that they're elastic as they need to be. So these little trigger points or adhesions in the muscle prevent the muscle from stretching like it's supposed to. So lengthening and shortening like it needs to. Drop down. So all I'm doing is just pinning down the tissue and then creating an internal movement. He's kind of taking some breaths here. This can be a little intense. Now when we're doing this, I don't want to get over like a 5 or a 6 out of 10. So when I have a response like that from the patient, I'm going to take note of that and back off just a little bit. Good, and we'll do one more. Drop down, come up. Perfect. Nice. Now I'm going to have him sit up, nice and easy. Good. And we'll probably be able to see a change already, but we have one more that we want to do. We're going to open up that posterior capsule of the shoulder. So this is deep, way up inside, right up in the joint line. And here you're going to rest your elbow on my shoulder, and then we're going to reach fingertips all the way up to the sky. So use that opposite hand to kind of rest on the table. So we're going to reach all the way up to the sky. And when we can't reach any further, you're going to start to side bend and lean on that arm. Keep reaching. Good. Reach through the fingers. Good. And back down. We're going to do a couple more passes there. Hanging in there, buddy?
Yep.
All right. Traction down. Big reach. Reach, reach, reach. Good. 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 There we go. Let's do one more here. And big reach. Big reach all the way through. Perfect. Go ahead and relax down. All right, so we're going to recheck. So let's have you sit over here again. We're going to recheck that movement pattern. So when we saw that initially when he went into abduction, this side was pretty restricted. So let's recheck. So come all the way up, all the way down. Let's do one more. Good. I want you to stop up at the top there. Yep, and we're pretty even now. And we still got a little bit to go. And we just did a little bit of treatment. Now I'm going to get him adjusted with that head positioning. We're going to try to get that to shift a little bit. All right, let's have you go ahead and lay face down. I'm going to adjust his thoracic spine and his neck. Now, as he's laying down, I'm going to initially just check and see how things are balancing. As I pull, I'm looking for where the movement wants to stop. So as I traction this leg, I see there's kind of a translation of movement up into this area. And when I traction on this side, yeah. So right about here is where that movement's not transferring up into the shoulders. So we're going to do an adjustment in the middle lower back here. So now take a nice deep breath in, all the way out. Good. Gently lift up the chin. Good. One more. Perfect. So when we do the adjustment, all we're doing is just telling the body that it's safe to go into a certain direction. We're stretching ligaments. When you hear like the popping sound, all that is just a gas that gets released from the joint, like when you crack your knuckle. Let's take a flip on your back here. All right, I'm gonna place this underneath. Hanging in there, buddy?
Yeah.
All right. Now we're gonna bring this up a little bit. We're gonna work with that head translation. So for this, we're going to bring to a side, shift, and then a little bit of extension here. And teeth together. Good. A little traction this way. I'm going to do the uppers on this side. Good. Right there. Whoo-wee. That was it. Good. Let's sit up. We'll do one more adjustment onto the shoulder here. Nice and easy. So I'm going to have you put your hands on your hips, chest up nice and tall. Now this is going to be to kind of set the shoulder back into the joint. A lot of times shoulders are rolled forward in internal rotation. So I want you to push your elbow back into mine. Good. Shift, shift, shift. Keep pushing. Good. And we'll do one more here. This is more for like AC joint. Good. So we're just trying to make sure that joint's set inside that capsule. So it's like a joint, like a ball and socket type joint in the shoulder. Let's do one more time, raise all the way up. There we go. How's that feel? Pretty free?
Pretty easy.
Good. All right, cool. So that's pretty much how we would treat a shoulder issue. Impingements, biceps tendonitis, rotator cuff injuries, all pretty similar types of treatments. With his case where the head's shifted over the side, that would be something where you could work traction to basically restore that positioning of the neck, to balance out the shoulder girdles and make sure that everything's moving the way it needs to. Rock and roll.